Managing Moral Distress in Clinical Practice, a presentation of WRHA Ethics Services. It's a busy night in the emergency department. Carol and Joe are working when a man is brought in by ambulance. He's edgy and tense and refuses to answer questions from the paramedics or emergency staff. He seems irritable and twitchy. He has a number of large open sores on his arms and face and dry, cracked lips. His temperature is high in spite of being found out in the cold without a jacket. The man is transferred to a stretcher in the department and positioned near the desk where staff can keep a close eye on him. The department is full. A little after midnight, Carol observes the man talking to himself. He's pacing the floor. His voice is getting louder and starts to sound like an argument. She approaches him and asks if he needs help. "Yes," he screams. "Tell them to leave me alone." Carol is taken aback. "Tell who?" she asks. Almost without warning, the man launches at Carol. He punches her in the shoulder. Carol falls and he kicks her in the ribs as he runs past. The overhead lights glint off a scalpel in his hands. He ducks into a staff washroom and slams the door. Joe sees the entire incident from across the room. He runs to Carol, calling a code white. The Code White team converges on the emergency department, and a quick discussion ensues. Carol reports seeing a weapon, and the decision is made to call the police. A number of officers arrive in riot gear, and the restroom door is unlocked from the outside. The team rushes in and subdues the man. He's forcibly sedated and dragged from the bathroom, where he's secured on a gurney in 5-point restraints. Carol is quickly attended. She's treated for 3 broken ribs and a mild concussion. Joe is shaken and finds it difficult to focus. His hands shake and his heart rate takes hours to settle down. He's shocked and angry when his supervisor assigns him to provide one-on-one for the man who attacked Carol. Joe tries to ask for another staff to do it, but they're short-staffed with Carol off and there's no one else. By the time Joe gets home at the end of his shift, he's furious. He calls in sick for his next 2 shifts, feeling unsupported and unable to face the prospect of more violent patients. When he does finally go back to work, he dreads the shift and finds it impossible to be engaged and empathetic. He finds himself eyeing patients suspiciously, wondering who might be the next to strike out. He also realizes he's profoundly angry with his supervisor for assigning him to look after the patient, and with the others who were on shift that night for not stepping in and offering to do it so he didn't have to. He begins wondering if it might be time to find a new place to work. Moral distress is the pain or anguish affecting the mind, body, and relationships in response to a situation in which the person is aware of a moral problem, acknowledges moral responsibility, makes a moral judgment about the correct action, but as a result of real or perceived constraints, participates in or allows the moral wrongdoing to occur. Moral distress is common in healthcare. Commonly reported causes of moral distress include clinical situations such as caring for patients in violent or other difficult situations, inability to provide adequate care for people because of short staffing or unsafe circumstances, lying to or deceiving patients, and inappropriate use of resources. Environmental factors such as inadequate staffing or resources, interdisciplinary conflict, time constraints, lack of resources, policies, or laws. And internal factors such as real or perceived powerlessness and personal values that conflict with workplace expectations. Joe's distress might be related to a number of these factors. This was an intense, high-stress situation for everyone involved. He witnessed more than one violent incident, the patient's reaction to Carol, and the forcible restraint and sedation. Joe was also required to provide care to a patient who had become violent and who might again. This was especially important considering Joe's state of physiological and emotional arousal, and the lack of opportunity to recover from that before he had to go back to work and care for the patient. Joe was aware that the patient was experiencing a medical crisis and required care. In spite of the difficult experience of watching his coworker be assaulted and being concerned for his own safety, he had no choice but to provide one-on-one care for the patient. He's torn between his work-related duty to care and his worry about personal safety and that of his colleagues. Moral distress often develops out of an initial incident or situation which causes intense fear, anger, or anxiety for the person. The intense emotion might subside after some time, but often recurs when the person is reminded of it. This can happen when the person returns to the place it happened, or when similar situations cause them to recall it. This residue can persist over long periods of time. The lingering negative emotions can have lasting effects on the person, including physical indicators such as upset stomach, headache, and insomnia, emotional upset such as anxiety, frustration, anger, and job dissatisfaction, behaviors like crying, lashing out, withdrawal, problematic substance use, disengagement, and avoidance, and spiritual symptoms such as a crisis of faith or loss of identity. Many people who experience moral distress over a period of time decide to leave their profession or seek work elsewhere. Joe experienced signs and symptoms from all of these categories. His emotional state is fragile, and he begins to withdraw from patients and colleagues. He's angry, frustrated, and struggles with empathy. He considers quitting his job. It can be difficult to feel like a good person or a good healthcare provider when you don't feel like you're able to do a good job, either because of your distress or because there are barriers preventing from doing what you think is right. Managing moral distress involves building resilience to it. Fostering resilience is about cultivating a quality of internal stability, awareness, and flexibility, which helps us to successfully navigate ethical challenges and use adaptive coping strategies. This means being able to recognize when you're experiencing moral distress, identify the source of it and understand its effects on you, including your emotions and the assumptions that you're making, examine the situation from other angles and perspectives, and act with empathy and compassion to address the cause or effects. Resilience, or internal stability in the face of ethically challenging situations, can provide the opportunity to use the distressing event or situation as a springboard for positive action. Joe's manager could see he was not happy at work, so she asked him about it. Together, they identified the violent incident as the initial, morally distressing event, and she validated and acknowledged the trauma. She invited Joe to sit on a working group looking at violence prevention. Over the next 2 years, Joe helped to develop a number of resources for staff and the public, and he became a support in the department for staff dealing with moral distress and for people who have experienced violence at work. The pain and anguish that's experienced when someone's involved in a morally distressing situation can resonate for a long time. Many people can describe events, including the emotional impact, in great detail for years. It can require formal counseling and intervention to recover. Being involved in positive action to address the underlying cause can be helpful in moving past the precipitating event or situation and preventing similar situations in the future. This helps with the feeling of powerlessness and frustration that accompany the experience of knowing the right thing to do, but being prevented from doing it. Although he did slowly regain his compassion and enthusiasm for working with patients, and was able to manage even the most difficult of situations, the memory of that initial event and its emotional aftermath still resonated with Joe for many years. However, he was able to use the moral residue from his experience to support staff education in violence prevention and compassionate care. It's important to identify resources and strategies to help you manage your moral distress. Talk to your manager about the issue. Learn ways to approach ethical problems. Emphasize self-care and consider counseling. And check the WRHA Ethics Services website for other resources. Moral distress occurs when we know the right thing to do but are prevented from doing it. This can have significant negative effects that last for years. Self-care, counseling, and addressing the issue can help build resilience. Remember, you're not alone. Moral distress is common in healthcare, and many positive changes have come out of some very distressing situations. Contact WRHA Ethics Services for more information or for resources on ethical decision-making and building resilience to moral distress.